but how do I put this right? Don't overcomplicate, just say hi or whatever it takes to break the ice. Don't walk away, there's more to say. I just need the courage to let you know what's on my mind. Like every time you pass by, something just feels right.
Okay. Hi, very good evening. I'm sorry for the delay. Right, we'll proceed directly with our discussion, right? So we'll discuss few key points from oral surgery, right? So also we are planning live sessions at 8:30 and 11:30 respectively. So you can join as per your convenience, okay? Right. So we'll start with oral surgery first. First of all, a very good evening. Hi, Niharika, Abba. Hi, Jayant, Rishi, Brijesh. Hi, Deepthi. Hi, Manan, Lavanya. Hi, a very good evening, right? So we'll just have a brief discussion for around 20 to 30 minutes maximum, right? Okay. So that you can even simultaneously prepare, right? And so we'll start with the first one. So how would you differentiate between a sign and a symptom? A general question. How do you differentiate a sign and symptom? I hope it's streaming fine and I'm audible, right? So if you want me to raise my voice, do let me know. Hi Aman, hi Akshit, very good evening. Yeah, so the faster you answer, the faster we progress. Hi Prashanti, hi Kumari, very good evening. Hi Parvin. So how do you differentiate, or what is the difference between a sign and symptom? So simply put, Giant says, sign is detected by the doc, symptom told by the patient. Good. Yes, Deepthi. Akshit, the reverse is true. Yeah. Sign is objective. Symptom is something which the patient elicits, that is subjective, right? Well said. Yes, hi Ajit Khan. Sorry, Ajiz Khan. I'm sorry. Hi. So that's the difference between a sign and symptom. So can you name one test which is used for evaluating capillary fragility? A test which is used for evaluating the fragility of capillaries. Okay. Yes, Prashanti. Tourniquet test. Okay, tourniquet. You try tourniquet and see. Okay, fine. Have you heard of something called as Hess test? HESS. Have you heard of this term anytime? Yes. So tourniquet test, also called as Hess test.
iPhone disconnected.
Sorry, yeah. Tourniquet test, also called as Hess test. Yes, Hess charting, Hess test, or Rumpel lady. Okay, good. So I'm glad you still remember. Okay, right. So, can you name one hematological disorder where general anesthesia is contraindicated? Anyone? Any one hematological disorder where general anesthesia is contraindicated. Yes, Angel, we have done those surgical blades in one of the image-based discussions, right? You can just go through the playlist oral surgery, check for image-based questions. We have discussed them in our YouTube live session itself. No, I'm talking about a hematological disorder wherein general anesthesia is contraindicated. Hematological disorder, Rohit. Anyone? Yes, bleeding disorders, hemophilia, sickle cell anemia. And also check out our key points in our E-classes in oral surgery section, right? Yeah, don't miss it. Yes, Shraddha, impressive. Okay, so Angel, since you asked, let me just ask you one question related to blades. Which BP blade and handle are commonly used in oral surgery? And what does BP stand for? So what does BP stand for, and which BP handle number and BP blade number are commonly used in oral surgery? Good, it's Hi Prithvi, Alankrita. Yes, it is Bard and Parker, right? Good. So which handle number and blade are commonly used? Yes, obviously 15 number blade, refer to our discussion videos. 15 number blade is commonly used, and if 11 is a blade, right? Handle number. Handle number 3, blade number 15. Fine? Okay, Andrew, that's okay. What percent of middle third fractures, the percentage of middle third fractures of skull that belong to zygomatic complex group? So what percentage of middle third fractures of skull belong to zygomatic complex fractures? Sometimes we can have these numericals as well, isn't it? And these coming few days, try to focus on revising your notes where you would have written memory-based points, and also we'll try to cover as many memory-based topics as possible. What percentage of middle third fractures of skull belong to zygomatic complex fractures? Okay? Yes, 60 to 70%. What do you call the amnesia which is seen after an accident or after trauma? Amnesia which is seen after a trauma. Yes, Angel? No video? Yes, it is streaming fine. Okay, what do you call the amnesia? Amnesia, loss of memory after an incident of accident or after an accident case. Is it retrograde? Good, Ananya, well tried. After, is it retrograde or anterograde? I said after the accident. Yes, before the event we call it as retrograde. After the event of or after the accident it is anterograde. If the same, before. Isn't it? Fine? Yeah. Anterograde, retrograde. What is concussion, Niharika? You said concussion. Hi, Shivaranjani. So what is concussion? So in the meantime, Niharika answer what is concussion, right? So tram line pattern on face and halo effect on pillows is associated with leakage of which fluid, and in which trauma cases do we see this tram line pattern and halo pillow appearance because of leakage of which fluid? So you might have heard of it. So concussion, you say it is blunt injury. Concussion is sudden blow. So concussions usually are seen because of sudden blow to head. Right? Okay. Yes, CSF rhino, very good. So tramline pattern of calcification, tramline pattern on face, halo effect on pillows. These are because of leakage of CSF, right? Cerebrospinal fluid. So previously we had discussed anterograde and retrograde amnesia, isn't it? So these anterograde and retrograde amnesia are indicative of damage to which part of the body? Yes, Niharika. Mild traumatic brain injury. Okay, in fact that's because of sudden blow. Okay, good. Yes, 343. So this anterograde and retrograde amnesia indicate which injury? Yes. Yes, temporal lobe. Okay. In fact, if they ask you like, these are in general indicative of cerebral damage, right? Yeah. Temporal lobe, and also certain drugs, benzodiazepines, they also can cause this amnesia. Okay, fine. So when you use the butt to cut a bone, for example, in impaction cases, you do bone cutting. So what is the threshold temperature beyond which there can be necrosis to bone? If you're using a butt to cut the bone, so what is the threshold temperature beyond which there can be necrosis to bone? Yes, it's around 60 degrees, 56 degrees centigrade. So Ananya, if you think the video is lagging, you can just refresh the page or you can try reopening the app. Okay? More or less, okay? 56 degrees centigrade. Fine. If I ask you to summarize various Leaford fractures, how would you explain them in brief? What are all the structures being involved in case of Leaford 1, Leaford 2 and Leaford 3? It's not just temporal lobe, Alankrita, it can be even hippocampus. There are various other sites which are being involved. In general, it's indicative of cerebral damage. Okay? In fact, it's mentioned that temporal cortex houses the hippocampus. Yeah, if you feel like video is lagging, refresh the page, right? Yeah. Yes. Leaford 1. Yes, it is low level fracture, horizontal fracture, transverse fracture. Yes, maxilloethmoid nasal. Yeah, mainly involves the tooth bearing portion of maxilla. Yeah, floating fracture. Good. So how do you summarize Leaford 2? Gurin. Yes, Shraddha. Yes. Pyramidal fracture. Yes, good. Subzygomatic fracture. Sub or infrazygomatic, isn't it? And Leaford 3. And by the way, I have a small surprise for you. Where I'll show that at the end of the video, right? So another 10-15 minutes, I'll show that present, or I'll show that surprise. Okay. Yes, Lefort 3. So this is subzygomatic. Lefort 3 is suprazygomatic. Yes, craniofacial disjunction, raccoons, dish fails. Yeah, suprazygomatic fracture or high transverse fracture. Yes. So all the symptoms and all we have already discussed in our e-classes. You can refer that for more information. Yes, Ajiz Khan, right. Okay, fine. If at all there is a CSF leak, how would it taste? What would be the taste of CSF leak? Yes, Preeti, Prithvi, Ranjan, Akshit. Salty. Yes, Ashin, Shiranjini, Prashanthi. Good. Has this salty taste, right? Okay. In case of elevating a depressed zygomatic arch, which elevator is commonly used? Name the elevator which is used for elevating a depressed zygomatic arch fracture. Yes, someone? Yeah, you can go through the clinical features. There will be elongation of face and depression of ocular levels. N of thalmos. N of. So name the elevator which is used to elevate depressed zygomatic arch fracture. Rose fracture, Rose forceps. Exactly. Bristow's elevator. Bristow. Bristows. Bristow's elevator. Okay. Yes, for maxillary fractures. Yes, Akshit. Lefort 1. Rose disimpaction forceps for facial fractures like maxillary fracture. We use it for grasping maxilla, right? So it's used for dealing with fractures of facial filling, that's fine. Yes, Ajish Khan, I think you're lagging. Yeah, so Bristow's elevator used for elevating depressed zygomatic arch fracture. So what is whitehead varnish? What is whitehead's varnish and where is it used and its composition? Whitehead's varnish. Yes. To arrest bleeding. Yes, Shraddha. Good. It contains iodoform, enjoin, balsam of Toulouse, solvent, ether, and storax. So it's mentioned that whitehead varnish is used in treatment of inflammatory conditions such as alveolitis or dry socket, and also as a post-operative dressing after maxillectomy. So it can be used for controlling bleeding. Iodoform, which is used, has anesthetic properties. So as Shraddha rightly said, it contains iodoform, benjoin, storax, balsam of Toulouse, and solvent, that is ether. Good. So do you want me to put that on board? Iodoform, balsam of Toulouse, benjoin, storax, and the solvent is ether. Right? So iodoform and benjoin, 10 grams. Balsam of Toulouse is 5 grams. And storax 7.5 grams. So these are the components of whitehead varnish. So it is used in treating inflammatory conditions like alveolitis, dry socket, as well as post-surgery to control bleeding. Right? Iodoform has this role of anesthesia, anesthetic properties. Okay, fine. So when you compare A delta, B, and C fibers, which one do you think has fast convection comparatively? A, B, and C. Yes, Akshay, you mean to say rose can also be used for zygomatic arch fracture elevation? Yes, Angel, definitely. Definitely I will share. Yes. Yes, Akshat. Thank you for adding that point. Yes, with bestos there can be the temporal fracture. So rose elevator can also be used. In fact, rose elevator is preferred, right? Yeah. So what you said initially, so along with this, yeah. Thanks, Akshat, for adding that. So rose zygomatic elevator. Okay, fine. So A, B, and C. Of these, when you compare, obviously A fibers have the fastest conduction, right? So around 100 meters per second. What about B fibers? It's around 3 to 14 meters per second. C fibers considered to be slowest, as you said, 0.5 to 2 meters per second. So A, the largest myelinated fibers, whereas C are small myelinated. Okay, so obviously A have fastest conduction. And also we have this various subdivisions, A alpha, A delta. You can refer our key points in e-classes for more information. Okay. So when you compare myelinated and unmyelinated fibers, where all you have come across this saltated transmission. So what is this saltated transmission? So when you compare myelinated and unmyelinated fibers. Yes. So you have myelinated fibers, you have these nodes of Ranvier, the points where you don't have this myelin shape. So there will be jumping or saltatory conduction because of these nodes of Ranvier in myelinated fibers, right? So we see faster transmission. Good. Yes, Sam, saltatory means jumping. Good. So now if I ask you, what is the most commonly used suture in oral surgery? The most commonly used suture technique in oral surgery. Not the suture material. Yes, angel. Impulses do jump. I'm not talking about the material, I'm talking about the suturing technique. Hi Parichay. So your back and you're given a bullseye answer. Good. The most commonly used suture technique in oral surgery, simple interrupted sutures. You might have practiced in your internship also, isn't it? So we have this criteria, like once you go for extraction, maxillary molar or premolar, what if there is communication with the sinus? So depending upon the size of communication, we have a specific protocol. So during extraction, if there is a communication established with the sinus after extraction, depending upon the size of communication, if the size is between 1 to 2 mm, if it is between 2 to 6 mm, if it is more than 7 mm, oral-antral communication you can consider, right? I'll just mention that here. Treatment criteria. What if it is 1 to 2 mm? Yes. Hi BA, that's fine. We have multiple sessions and you can go through this video also, right? So what if there is a communication of 1 to 2 mm? Good anemia, so we leave it, right? Or we allow the blood clot to form and then we leave it. It should be left alone. Good. Yes, Abhishek. What if if the size of communication is between 2 to 6 mm? Yes, 1 to 2. I hope you can see right here. Let me just write down here. 1 to 2 mm. Leave it. 2 to 6 mm. So 2 to 6 mm, yes, you go for suturing. Approximation. More than 7 mm, closed by flap, palatal flap. Good. We already had this question also in our test series. Anyways, the size greater than 7, it's closed by flap. Surgical closure. Fine. So normal prothrombin mean time and all, I think we already discussed in our key points in pathology. So name the scientist who has given the closed mouth technique for infraalveolar nerve block. Yes, Aman, but the issue is when you use buccal flap, there will be cheek and there can be issues with approximation. So palatal flap is commonly used flap for closure of your orogenital fistula. Yes. So name the scientist who has given this closed mouth technique of IANB, inferior alveolar nerve block. So I think that's your favorite block, right? So have you ever tried closed block, closed mouth? Yes. Bingo. So it is Vajrani Akinos, right? So name any one scale which you know, which is used for assessing consciousness. Okay, Abhishek, yeah. When we had never used it. Okay, Glasgow Coma scale we have discussed. In fact, Glasgow is a single word, right? Glasgow, Glasgow. Yeah, so Glasgow Coma scale we have discussed in detail. So if I say Glasgow Coma scale gives accurate representation of neuronal condition of a patient, true or false? Yes, good, Prithvi. It's false. It doesn't accurately give the status, the neurological status. I mentioned in one of the live sessions previously, accurate status, we need a list of various signs which have to be evaluated, right? So it only gives us a gross overview, which is not accurate, right? And if I ask you if Glasgow Coma scale, can it be measured in conscious and unconscious patients? What would you say? So Glasgow Coma scale gives only an overview, but it's not accurate representation of neurological status. Yes, both in both conscious and unconscious, right? We discussed the minimum score is 3, maximum 15, less than 9, poor prognosis, right? Fine. So one final question. You might have gone through articular disc, right? TMJ articular disc. So which part of articular disc is considered to be vascular? So which part of vascular disc is vascular? Articular disc is vascular. Yes. The retrodiscal tissue is considered to be highly vascular and innervated, right? So entire disc is avascular in general, but the retrodiscal tissue, as you said, is considered to be highly vascular and highly innervated. Yes, retrodiscal. Fine. So it's been already 40 minutes. I said I will stop it here, but before that, before concluding, I said I have a small surprise for you. So I'm going to get the surprise. Fine? 2 minutes.
Battery 70%. Battery 70%.
Break down the awkwardness. Put on my boots and a lily white dress. A million words, but how to express
Puzzle
what I'm
device
feeling
not
when
found.
I
Ready
see
to wear.
you flash a smile. I'm like, is this happening?
Say hi.
I look your way and then of course drop everything. You walk over.
Say hi, Toffee.
Ask if I'm alright. Hey, whatever it takes to break the ice.
Okay. Yeah. Say hi. Say hi to everyone. See, look at the camera. So Toffee is back again from holidays. Toffee has been holidaying in Hyderabad. So it has returned from Hyderabad just now, just 15 minutes ago. And here we are. So you have been asking for Toffee before exam. So we'll have Toffee in every live session from today, right? At least till Friday or Saturday. Okay? Okay, Toffee. I wish them all the best and convey all your love and regards to them. Okay? Right, Toffee? Okay. It's not fear of camera, it's not understanding basically what's happening. Okay, fine, right? So we'll see you again. Right, we'll see you again at 8:30. So we're having another live session at 8:30 and the third one at 11:30. We'll come up with another subject, right? So in the meantime, I'll just enhance this with various colors and share yesterday's as well as today's notes, the soft copy in our Google group, right? Yeah. Okay? Right. So see you again at 8:30 p.m. Okay? Yeah. Bye. We all take care. So in the meantime, you just carry on with your preparation. So consider my live sessions as break, right? So let's have some fun simultaneously. This questioning pattern, and we'll have it, simplest format possible. Okay? So just keep on giving your best, and you can take up our live sessions as a break time. Okay? Yeah. Bye. And in the meantime, I'll be calling few of you. So please keep your phones alongside with you. So I'll be calling few more aspirants today. Right. Bye. Yes, glad to hear that. Yes, we have another live session at 8:30 p.m. today and again at 11:30 p.m. today. Yeah, you're most welcome. Thank you for the feedback.